We are back discussing recommendations for exercise in bariatric surgery patients. Last 2 weeks, we went through the 6 recommendations. We are gonna continue now with recommendation number 7 states that patients should delay water exercises for approximately 4 weeks after surgery. We know from Archimedes that underwater our bodies don't feel the full weight because the bodies are pushed up by the buoyant force. Water aerobics as well as swimming, great time of aerobic exercises that will improve fitness. Again, delayed a little bit for a few weeks after surgery in order to allow for wound healing. The next recommendation, number 7, is one of my favorite and it has to do with resistance training. Patients have heard me preaching over and over about the importance of weightlifting or resistance training. Some people also call it time under tension. Unfortunately, weight loss surgery, just like weight loss with medications, can also lead to loss of the fat-free mass or the muscular mass, as well as decrease in bone mineral density. So the only way to prevent this muscle loss is to train the muscles with some form of weightlifting exercise. The authors of this article go into a great deal of detail regarding the exercise regimen they recommend, but my take on it is that patients should perform whole body exercises or compound movements rather than isolation exercises to grow one particular muscle, such as the biceps. So we fully encourage resistance training in combination with aerobic exercises. The people who do both lose more weight than just people who do aerobics. And in addition, this leads to improvement in insulin sensitivity, as well as improved in cardiovascular fitness and muscle fitness. Recommendation number 9 states to delay high-intensity training for 8 to 12 weeks after surgery. The authors include here high-intensity aerobic exercises such as running, high-intensity training, high-impact aerobics, as well as intense weight training. This recommendation, in my opinion, has a low level of evidence, and I think it is important for patients to have a progression of their exercise from easy at the beginning to more intense as the time goes by. There are a lot of changes that happen with the body of a bariatric patient after surgery. The fat goes off pretty quickly and the weight center tends to move from the front if they had a protuberant abdomen towards the back, and this is changing on the spine. So it is very important to start progressively, don't overdo it, and most of all, avoid getting hurt.